So, hi everybody, my name's Alison Power and it's my pleasure to be moderating today's IPE Global Cafe. I'm a member of the CAPE board and also on the capacity building group with IPE Global. So it's my absolute pleasure and privilege to introduce you to Dr. Melanie Stevens. And Melanie is an associate professor in adult nursing at the University of Salford, which is up north in England. And she's been at the university for 22 years, but before this, she worked in lots of interprofessional teams in the fields of diabetes, burns, and plastic surgery, ICU, and tissue viability. And then when she joined the university 22 years ago, she became the lead and then the head of interprofessional education in the School of Health and Society. And she led on the development of innovative interprofessional and international education and placement opportunities for their undergraduate students. Now, Melanie's a health and social care researcher, and she still contributes to the under and postgraduate programs, but she's very heavily involved in research projects. In the past, what have we looked at? Virtual wound care clinics and placements in Uganda, the impact of interprofessional student training in care homes, which she's going to talk to us about today. So very, very busy profile, and we're absolutely delighted that you've taken some time out, Melanie, to come and talk to us about IPE student training in care homes. And I will pass the mic to you. Thank you.
Oh, thank you, Alison, and thank you for that introduction. And I'd really like to thank Alison and Interprofessional Global for this opportunity to present the work on IPE care homes. And I'd just like to say at the very beginning, I'm presenting on behalf of a large team across education and practice who've have had the absolute honour and privilege of leading. So the research team is there, but this was a very big collaboration across 4 higher education institutions and our partners in the care homes. So what I'm aiming to do this afternoon is give you some background information of how we got to such a project, give you some information about the UK care home environment, look at the definition of interprofessional education, because at Salford we reconfigured that for our local needs, then look at why we decided about IPE in care homes in particular and the current gaps, and then look at our pilot study, how we tested our framework, and then describe our longitudinal study design and share and discuss our the findings with you. So it all started back in 2019 when I was very fortunate to visit Nijmegen in the Netherlands, where they have a patient recovery centre. This is a 180-roomed centre that allows students to have an interprofessional working experience, so they're better acquainted to integrated practice on registration. This is through the formation of communities of practice, and the students are there to address and solve issues for the patients who are staying there, integrate new professional routines, share their knowledge, and is this lovely joint capacity between theory and practice. Professional development of the students and the staff is influenced by the constant presence and reflection processes, the students, the teachers, the researchers of the local university. And what I saw was this lovely expansion and growth of a professional network, and this continuous and structured collaboration with the university itself. And again, this integration of real research activity within the degree programmes. And it allowed practice to have a real large role in the programmes of the students, and this really fantastic, valuable relationship. And for the Nijmegen University, it gave them a really strong position in comparison to other HEIs, so for future marketing and recruitment of staff and students. So when I got back to Greater Manchester with the rest of the team, we thought, well, how can we make this happen in Greater Manchester? So we wrote a business case to actually build our own recovery centre, and we tried to recruit interest from intermediate care and rehabilitation units. But what we were met with often is where your proof of concept was. And during these multiple meetings that I had, I actually met someone called Carol LeBlanc, who was a project management officer for nursing and midwifery. And she said, well, if you need a proof of concept, there's some money coming from what used to be called Health Education England, which is now NHS England, called Enabling Effective Learning Environments, where there was money available to expand placement capacity and opportunities for students in new and innovative ways. And it really proffered us this opportunity to conduct a feasibility study. So I was thinking, right, this is fantastic. I'm the head of IPE. We need to look at innovative ways. I'd really like to provide proof of concept. So let's try this out. So we were having discussions and we thought, well, where can we try? So we've tried rehab, we've tried intermediate care. Well, let's look at the UK care home environment, because this is an area where very little students are placed in the United Kingdom. So let's have a look. And from meeting the care home managers and working with the staff in social care environments, what we could see is embedded perceptions where the care homes were viewed as a last resort, not just a last resort for the staff who work there, but the residents who live there and the family members who were having to place their relatives in the care homes. And we know across the United Kingdom, there's a significant number of care homes. 70% are what we call residential, so residents being looked after by non-registrant staff, and 30% nursing homes where residents are looked after by registered nurses, and they employ a significant number of individuals to care for nearly 450,000 residents. And what we saw through the pandemic at the time was there was real threat from workforce and funding crises, and it was getting complicated by the pandemic. And also there was no career pathways within social care environments. So students weren't seeing it as a really attractive place to have a placement there or to have a future career there. And what we were seeing within the sector was a call for innovations, including an increase in the number of allied health professions, because what we were also seeing across the care home sector was it was mainly nursing focused with very few AHPs. And within NHS England documents and policy, the NHS long-term workforce plan was all about, let's create this resilient workforce, let's prepare our workforce for the future and make sure that within our pre-registration programmes in health and social care, that actually social care is a part of that, those placements. And the last thing within higher education institutions is there was a project called the Repair Project, because what we were seeing is there was a loss and attrition of students, especially in the second year in pre-registration programmes. So we wanted to think of innovative ways to improve retention and enhancing the reach and scope of nursing and AHP placements. So I just want to take us back to the definition of IPE. So it's right, we can do it, we've got some funding to carry a study out, a feasibility study, we've got the environment, there's lots of things we can address by having students in the care home environment. So let's look at IPE. So obviously the CAPE definition that was revised in 2016 talks about members or students of two or more professions learning from, with and about each other to improve collaboration and quality of care. But whilst I was head of IPE at Salford, we did a survey of staff and students, because I kept meeting lots of staff and students who said, IPE is not for us. The word profession excludes us from that opportunity. And what's that got to do with sports rehabilitation students? What's it got to do with counselling students, sociology, psychology, clinical psychology? So I conducted a survey at the time with the staff and students and asked them to come up with our own working definition that was inclusive of everybody within the School of Health and Society, so that everybody felt that they could participate in IPE. So back in 2013, we actually defined IPE as this definition. So it's people, and you can be from any disciplinary background. So we're not, because if you don't personally subscribe to a profession, you're still included in this opportunity so that you can work and learn together. And because we're a university, we're thinking of research and personal and professional development across all the sciences, and making sure that the planning and decision-making processes have an impact on everybody across the lifespan. So it was just to say that that's the definition we use. So why then conduct this IPE in care homes then? Of what relevance is it for us in Greater Manchester, and in particular from Salford? Well, we all know, well, I know from research that I've conducted and activities as head of IPE, that we focus IPE both in clinical and educational settings. The feedback that I've always got from students from IPE I've conducted is they really enjoy it in clinical practice, because that's where they'll be working when they complete the programme. Our professional bodies ask that our students participate in IPE, and because this also addresses their professional standards, it could be their professional pillars or their proficiencies. And looking at the literature and seeing the work of the Recovery Hotel, but also then the Interprofessional Student Training Board from Sweden, it was this real opportunity to actually test in the care home environment. And there was emerging evidence that actually conducting IPE in care homes allows students to understand different caring practices. It improves social connectedness of students and students with older people. And the really lovely thing is that the students become more skilled and knowledgeable in this speciality of aged care provision. And what we saw as gaps in the literature was there was very few studies that actually investigated IPE in the UK care home environment. And across most of the studies, the outcomes always pertain to student learning rather than the impact on the organisation, on the staff, or on the residents. So this proffered this gap for us to study as part of our pilot study. So we called it Not the Last Resort, because what we wanted to do is demonstrate that care homes weren't the last resort for residents, for care home staff and for students. And in fact, they were a really rewarding place to go and work, live, or have a placement there. So we took learners from 4 universities across Greater Manchester. I didn't want it just to be the University of Salford's project. I wanted to open this up to colleagues and students at the University of Manchester, Manchester Metropolitan, and the University of Bolton. So we recruited students from a range of health and social care professions, which you can see on this slide. So we recruited 14 students who were placed in 3 care homes. The placements varied from 6 weeks to 13 weeks. Some students were on placement full-time, others were there on placement part-time. Some were placed as part of a natural placement circuit. Others actually self-selected because they weren't from our usual student pool. So, for example, physiotherapy, sports rehab, podiatry, prosthetics and orthotics and counselling students wouldn't necessarily have a care home placement. And they were placed in 3 care homes across Greater Manchester to work as a multidisciplinary team with staff, residents and an academic facilitator. So this was all about testing our ideas. We wanted to test, could we create opportunities for IPE in the care homes using what we call a 6-week period of overlap with our current academic placement planners. Because what we did is we took the academic year planners for placements for the 4 universities, huge big spreadsheet and then looked at occurrences and how long they were, and when we could have these periods of overlap. And also from my own PhD study, I found that within a 6-week period, it proffers that opportunity if there's regular meetings and students are brought together on a regular occasion over a 6-week period, we start to see a change in their attitudes, values and beliefs, from just identifying with a group to actually starting to modify their attitudes and behaviours. So they become internalised that integrated working is, the best way of working. We also wanted to test whether we could create a structured IPE intervention. So we chose to conduct weekly action learning sets that focused on residents' goals within a community of practice. We also wanted to evaluate, well, how many residents could the learners work with within these action learning sets over a 6-week period of time. I think I'm always ambitious, I like to think big. We thought we could have more residents, but we realised 2 was enough for the students to get to know the residents and to address the goals. We also wanted to look at the methods of evaluation. Were they the right ones we were collecting? So we used the Ripple score, the ageing perception score, and then also conducted semi-structured interviews at the beginning, at the middle, and at the end of the 6-week the IP scheme. And also it gave us opportunity to identify any challenges, because obviously if you think about 4 very large universities, I mean, at Salford, we have over 2,500 pre-registration students across nursing, midwifery and AHPs. So it becomes a huge task. We also wanted to look at these embedded negative perceptions of care homes, because we found that while students wanted to participate, they got feedback from academics and practitioners who were offering supervision on a long arm that why would you want to go and work in a care home? So this was trying to change this embedded negative perception. Long arm practice supervision, whilst has been well established within the social work programmes and occupational therapy programmes, is really something quite new for other pre-registration programmes such as nursing, physiotherapy, podiatry, prosthetics and orthotics. So that became a challenge with confidence and competence of supervisors. We also wanted to change the culture of the registered nurses in the care home. They thought they had to didactically teach students and move them away from that to one of action learning, where it was facilitated learning for the students to have actions and reflections, and then also to test the length of time in the care homes for students, whether they should all be full-time or part-time or split site. So we wanted to explore all of those ideas. So what we found out is that the pilot really highlighted that a structured scheme in a care home setting has real benefits, that the learners started to develop their interprofessional competencies. They reported on improving their team working skills, their leadership skills, learning new professional skills and clinical reasoning. They became more autonomous and they started to change their perspectives about aged care. The staff reported that they'd learned the newest evidence-based practice, especially from the AHPs in particular. It released time to care because the students were working with 2 residents, so it allowed staff to focus on other ones and the students to focus on those residents. And they also accessed new equipment, new interventions, new ways of working. And the lovely feedback from the residents was that they talked about this sense of meaning and purpose, which was about that they were giving back to the future nurses and AHPs, that they were helping them to become the best nurses, physios, sports rehabilitation professionals. And also they really appreciated having some focused care on a goal that they'd decided they wanted the students to work with them on. So this was just a pilot study, it was a feasibility study, so it left us with lots of important questions. What would this look like if we ran it long term and it became a sustainable activity? So then this was like the next piece of the puzzle. So because I'd already received funding from Health Education England, I was encouraged, the team and I were encouraged to apply for more funding to look at investigating the longer term impact and recruiting more care homes. So our aim of this longer term study was to look at the experiences of 3 groups of the learners, the residents and the staff, but actually to have more cycles of the IPE initiative, and then to measure the impact. So evaluating, understanding the impact on staff's knowledge, skills and personal development, learners' knowledge, skills and personal development, the residents' experiences of the care that they're provided with, and then obviously disseminate this key learning and best practice to other HEIs, other care homes, and obviously to the health and social care sector. So because this was a collaboration, when we wrote our ethics application, we took the approach of utilising Heron's cooperative inquiry. So this is a participatory research approach. So this is about doing things with people rather than on them. So we were very lucky, we had 3 groups who helped us with the development and design of the project, the delivery of it and evaluation of it. We had a fantastic steering group who was made up of an interprofessional team from senior people within health and social care, including the CQC, Adults, Greater Manchester Health and Social Care Partnership, Greater Manchester Combined Authority, and some of the integrated care boards, and they helped steer and check that we were running in alignment with our ethics application, we were on budget, and we actually were meeting the aims and objectives of the project. We then had an interprofessional core operational group, which included myself, the research assistant, placement leads, programme leads, practice, education support staff, and long arm practice supervisors. So we had on the ground support for implementation of the project. And we also set up a care home support network. And this was academic staff who became multidisciplinary team facilitators, so action learning set facilitators and the care home managers. And this was a real supportive and collaborative space in the run-up to the delivery of the 3 cycles of IPE and during the 3 cycles of IPE, because we wanted an opportunity for that reflection of those involved. So at the outset, we wanted to recruit 4 care homes. We in fact recruited 5. We were very fortunate, and there were a real mix of care homes. So some were what we call residential homes, so there was no registered nurses, and then others were nursing homes. Some of the residents had dementia. Some of the units were a mix of adults with multiple comorbidities. And it just gave us that rich opportunity to explore IPE within different care homes of different specialities. The next job was then to look for cycles of overlap, these 6-week periods. And as you can see on this slide, back in 2023, we were able to deliver 4 cycles instead of 3. And the reason we did this in some of the care homes due to sickness, with some of the residents, or there was an outbreak, we had to suspend a cycle and then restart the next one. So in total, 40 learners from the University of Salford, MMU and the University of Bolton were placed in the 4 care homes across the 4 cycles, which meant we had on average 2 or 3 learners from the groups named, as you can see in red, within each cycle. So there was always 2 or more professions. So we had nursing students who were either in the United Kingdom, we have different what we call fields of practice. So we have students studying mental health nursing, adult nursing or learning disability nursing. We had sports rehabilitation students, physiotherapy students, occupational therapy and dietetics. So the IP initiative, the framework this all was wrapped around, we called it multidisciplinary team meetings. Now, I know it is in complete difference to IPE, of what IPE is, but when we wanted to say the words, well, we're going to run communities of practice or action learning sets, the care home managers and the care home staff felt it was a very academic term, and it frightened. They actually talked about feeling frightened that this was beyond their level of knowledge and skills and abilities. So we have to use the terminology, don't we? As cooperative inquiry, we have to make everybody feel comfortable. So everybody decided that MDT meetings was something that everybody felt happy with. But the purpose of which was to utilise action learning to foster interprofessional development and use the wonderful activity of reflection. So the students met weekly in these to work in these collaborative multidisciplinary teams, and they were there to address a resident's individual goals. And obviously it was informed by the principles of action learning. So week 1 was all about meeting each other and meeting the residents and learning all about what action learning is. And this was attended by the learners, the residents, the care home staff, and in the first 2 cycles was supported by an academic who was well versed in facilitating action learning. And the goals that the residents might decide to choose, and it was personal to them. So for example, one resident said, well, actually, I've just come out of hospital. I'm only managing to move from bed to chair. I'd like to be able to stand up and walk and take a few steps. One gentleman who has diabetes, he'd said that he'd learnt a lot about new changes to his diet, and he really wanted to have help with understanding that. Other residents wanted support with social activities. So one gentleman with early onset dementia really loved music. He used to play in a band and he played the harmonica, and his brother played the accordion, and he actually wanted to put on a concert for other residents in the care home, and he wanted the students to help him do that. He had problems with his dexterity of his hands, and he had poor posture in the chair, so they were going to help improve his dexterity and his posture. So within 6 weeks he could put his concert on with his brother. So there was a really nice activity. So week by week we deconstructed the goal. So for example, the gentleman who wanted to play his harmonica with his brother, the students in the first week got to know the resident, went and read his care plans, his notes, spent some time with him, spent some time with the support staff and the care home manager. And then they wrote a SMART goal of how they were going to help him. So this included doing assessments on his posture with the physiotherapy students. There was an assessment of his dementia and his capacity to remember and understand things with the mental health nurse, and then look at his diet with the dietetic student at the time. And by the end of each week, the students would present back information that they'd learnt about the resident and their reflections on that, and the next actions that they would take a week later, so that they could help the resident achieve that goal. And they said these things in front of the residents, so it wasn't just education for the students or the staff, it was also education for the resident themselves, and the resident gave feedback about how the students were doing in regards to the soft skills, but also about some of the interventions and activities that they helped participate in. So obviously this was research, and it was really important that we wanted to carry out an evaluation. So this was a mixed methods evaluation that ran alongside the 4 cycles of IPE. We had 2 components. One, that the students and the staff completed a weekly digital survey. So we created these digital surveys, and you can see on the slide there, we were asking about what level of positive impact do you feel your involvement in the initiative has had, and we measured knowledge, skills and personal development. So we asked the students and the staff to say whether it had no positive impact or it had major positive impact. And underneath each of the digital surveys was an open-ended box where we asked them to fill in information about, so if it was a major positive, moderate or major, what had you learned? Could you tell us more information? Or if there was no impact, why do you think it stayed the same? So this was a repeated design, and the students and the staff repeated these every week for 6 weeks because this was action learning. We wanted to see week by week through the actions and reflections if the students and the staff had learned anything. We also then conducted interviews with a smaller sample of care home managers, care home staff, residents and the students, because we wanted that richer insight into people's experiences and also the long-term impact in the home. We wanted to find out from the care home staff and the managers, what was the impact of having students through these regular cycles in integrated teams on you, on the residents, on the families, on the environment itself. So some of our qualitative findings. So we utilised this knowledge, skills and personal development framework to analyse the qualitative data. We found that the feedback was all about promoting new knowledge, sharing it across diverse healthcare professionals. And you can see at the bottom a really nice quote from a physiotherapy learner talking about the complement between themselves and a student nurse. The students talked about in their feedback about exposure to different perspectives and practices within this collaborative setting, which really broadened their knowledge and understanding. And we received the same feedback from the care home staff. So they talked about learning about real integrated team working, but because the pace of the home was slower, they were able to really think about holistic approaches to resident care, whereas the students talked about in comparison to clinical practice in an acute setting, really having to focus on tasks or the skills that their assessor or mentor wanted them to attain. Everybody talked about a broader skill set, about developing leadership, having time for creative thinking, and being able to manage time from assessing to implementing the care to achieve the goal of the resident. Learners spoke about gaining the ability to formulate really well-rounded care plans, because at week 6, we asked the students to write an integrated care plan, which they would then hand over and present to the care home managers and the senior support workers who were looking after the residents, so that care could continue. And they talked about other skill sets that they'd learned, such as good postural care, moving and handling techniques, even talking about they'd learned about the theories of cognitive behavioural therapy and simple techniques. The students and staff also talked about that the IPE activity served as a catalyst for personal development. This constant action and reflection helped build this person-centred mindset. They gained confidence in their own skills and abilities, and they all talked about having strong professional identities. There was a worry from some of the allied health professional students that there'll always be more nurses than us, and they thought they would be consumed by nurses, but actually they said it really helped them have a strong identity. And everybody talked about how the journey of being as part of this project was engaging, it was transformative, they felt empowered, and the students have even emailed recently to talk about how they've used the residents in their final dissertations and projects. And finally, the learners often referred to the societal perceptions of care homes and actually coming in with those, but leaving, saying that there was real value and rich potential of working in social care. So other qualitative findings were more long-term. Obviously, we wanted to test that whether this framework is sustainable and valuable. And what the care home managers said is it actually gave them a really nice framework for future placement planning. So when they've got quite a few students starting at the same time, by utilising this framework, it gives them opportunity to really plan placement for students, make it engaging, worthwhile, which meets the students' proficiencies or competencies or pillars. They talked about it enhancing communication across the disciplines and really helping with comprehensive and integrated approaches to care. The staff talked about, because they were engaging in multiple cycles over a longer period of time, they learnt lots of new skills, but they also learnt to deliver action learning sets, and they could facilitate NDT meetings. And they enjoyed learning about these new pedagogical frameworks to improve the lives of residents. They also talked about IPE being really important for future practice and the lasting impact it had on quality of care for residents. And it led to sustained improvements in the care home environment. So we had feedback about these new interventions, new techniques, new dietary guidelines, new care plans and activity plans, new indoor equipment such as cycling and bowling equipment that was bought, and all continue to be utilised and are having benefit for other residents. And then the residents express this real heightened sense of well-being, and you can see there from resident, we call it resident 6 in our study, who I think for me, it hits me every time when she says that this lady, and she's been videoed and she's out on our website and things like that, on Greater Manchester websites, she felt they opened the door and let her be free. I mean, that's a huge statement for a resident to say that engaging in IPE as a resident with students, they did something really impactful for her. So for us, that really, you know, played to why we were there. Obviously, we collected some quantitative findings in regards to self-reported knowledge, skill and personal development. So we gathered the data from the surveys and the scores taken from the participants in these weekly cycles, and we analysed them using SPSS. So we wanted to look at the difference in mean scores, and what we found after running paired t-tests is that the mean scores from week 1 to week 6 demonstrated there was statistical significance. So basically, we're confident we can say that the changes to the mean scores, they're not random, and actually they indicate a relationship between the initiative and how the students and the staff ranked their knowledge, skills and personal development. You can see the increase in the scores from knowledge, skills and personal development. And obviously this allows us to say that we can start to generalise to the broader population, that they've not just happened by chance, and they're supported by the qualitative findings and the experiences of the staff, students and residents. So the last component really is what we learned. So really what we've learned is the way it fits within each home, and each is different because it depends on the size of the home, who lives there, the staff who work there, and the number of students that they can actually accommodate. So we work very closely, have a great relationship so that we don't overburden the homes. And we also want to make sure that there are some breaks between all these cycles of IPE activity. We also looked at facilitating factors, and it's finding the right homes. In the pilot study, we recognise that sometimes the management style of the care home manager impacts on the delivery. So it's finding the right environment, and also that care home managers and staff who are open to the process of action learning and facilitating learning rather than traditional didactic methods. We're still learning about allocation processes, it's huge, and long-on practice supervision for some professions. And also there was a lot of work halfway through this longitudinal, this long-term study. We were asked to change some of the AHP students' split site placements to just 1 day a week, and they didn't work well at all. 1 day isn't enough for the students to attend the NDT meeting and develop a therapeutic relationship with the staff and the residents. So we're very fixed that we're not budging. They've got to be at least 2 to 3 days if it's a split site placement. And then sustainability. So in the United Kingdom, long time ago, we used to have a very famous TV personality called Fred Rogers, who ran a programme with, if you were good at solving puzzles, you won fantastic prizes. If you weren't, you won a dusty bin, literally a bin. But often, as it says, you think you're at the end of something, you're at the beginning of something else. So we're now at this stage of sustainability. I'm really happy to say I met with all the care home managers a couple of weeks ago, and they're now on running IPE action learning sets regular now with our students. We're working to develop relationships with other programs where students aren't participating at the moment, and developing long-arm practice supervision guidelines and training materials so that we can have more students from different professions, because we've got so many across Greater Manchester. So we're really looking forward to developing that further. And then our next steps, obviously, I've just said we're working on these sustainability strategies. And I've recently been very fortunate to recruit 4 other universities across England, and we're applying next week for a 1.8 million bid to NIHR to actually develop this into a national project to evaluate the long-term impact of a repeated measures mixed methods design on residents in particular. But if you'd like to learn more, my details are there. There's a link on the slide. I'm happy to share them with you. A link to our webpage with all the pilot study and other papers, process papers, and I'm happy to talk to anyone, answer any questions. So thank you very much.
Thank you so much, Melanie. It's a fantastic project, but also the way you presented it today, so clear, so transparent. It was a joy to watch, so thank you so much. I have got a couple of questions in the chat for you. So the first one's from Hester, who is in the Netherlands, and she asks, are these educational programmes across educational levels? This is a challenge in the Netherlands because we know they have 3 educational levels: vocational, such as nurses, University of Applied Sciences like physios and dietitians, and psychologists and doctors. So 3 different levels of learners, I guess.
Yeah, I think for us, we only had BSc. No, actually we didn't. We had BSc and master students. So we had students who were studying master's level and degree level. And some were second years, some were third years, and obviously master students were first years. We were very good. We had fantastic programme leaders who mapped the competencies to the care home, and then they wrote guidance on what the students could and couldn't do, to make sure they felt safe and boundaried, but also to help the care home staff. And you wouldn't know, nobody really spoke about what level or programme they were studying. They were more concentrated on the residents and how they could meet the goal, which was, and it also because the goals were person-centred and softer goals, not the usual, oh, we must treat an illness or a disease or surgery or an intervention. It meant they had to think differently. So for example, I use the example of the gentleman who had early onset dementia, wanted to put on a concert. it really flummoxed the students to begin with, because they were, well, we're physios, we're dietitians, and we're mental health nurses. How are we going to help this person put a concert on? But using action learning to deconstruct what does the final outcome look like and how do you get there? They really learned a lot then about dementia, about medication, about posture, about wheelchair services, about pressure relief and seating, music therapy, sleeping position. They learned so many things that it was that unexpected learning throughout.
It was taking them out of their profession. As you say, it was all around the service user and the resident, what they needed, not what, as an individual student, what do I need to learn as a physio or whatever. So that's what's so beautiful about it. I think it's fantastic. Hopefully that answered your question, Hester. If you want to pop anything in the chat or put your hand up, please do. I've got a question from Jonathan Berry, Manchester University. So he's saying, what was the biggest challenge with the long arm supervision? Was it student confidence or academic supervisor concerns, which are often legal or indemnity related?
Yeah, so it was very much clinician and academics, especially from one particular group of AHPs who'd never done it before. So you could understand it requires competence and confidence. We were very fortunate that we worked closely with AHPs from that profession who said, well, I'll be the long arm practice supervisor in this first instance. I'll put my money where my mouth is and test this out. And then they wrote some guidelines for the longer study, and we're developing even further. So I'll invite you, Jonathan, in 2 weeks' time, we've got a focus group where we're just trying to validate the final guidelines for physiotherapy in this instance, so that we can then develop training materials.
That's great, Melanie. I'm a pharmacist by background, and they're really risk averse as a profession. And in a previous role, I worked down at Keele in the Midlands, and I presented something similar, not as well formed as what you've delivered today. Thank you. And people ran a mile, and they said, "Oh, how are we going to do this? How are we going to supervise them?" And we actually managed to get it through on a uni-professional basis, but not a multi-professional basis. And it was some of the nurses who were actually resistant to what we were trying to achieve, we found. So thank you very much for that. That'd be great.
Yeah, and I think it's that confidence, isn't it? Confidence and competence. And what we did at the very beginning, which I haven't mentioned, I invited the professional bodies at the very beginning of the feasibility study and said, this is what we want to do. Will we contravene anything in the standards by the professional body? And they were very supportive. And then we also contacted the various different societies, so like the CSP, RCOT, and again, they said, actually, no, what we want to do is we want students to be able to have access to health and social care. So we're very supportive of this activity, and they're actually putting the logos on our guidelines now because it's good for them.
Fantastic. I've got a question from Kelly she's in the States. Do you have any plans to follow up with students post-graduation about how this learning translates into their professional practice? Brilliant question.
Oh, that is a good question. And I'd like to, because with my PhD I asked students up to 18 months post-qualifying the impact of IPE activities on them and what could they remember. So yeah, I think that's a really good idea. It's funny, I met students last June and they've emailed me this last 2 weeks saying, just to let you know, still really have thought about the residents I work with, we're including them in our dissertations. And 2 students we put forward, they don't know it. So when they go to the graduation in December, they receive some student prizes because they were just incredible. So we wanted to acknowledge their participation in the project. And the care home managers don't know, but we've put them forward for some chief nurse awards as well, because it's just, you know, it's not just about us doing research, is there? It's about everybody, a win-win for everybody, and they've been tremendous. You know, I've been very humbled that they've allowed us into the care homes to work with residents, to conduct this research, and it's just been fantastic. So I'm very grateful to them all.
Brilliant. I've got Inga. Sorry, Inga, I'm not sure where you're dialing in from. She's a frailty pharmacist working in medical education, and she'd love to see the model involving medical students as part of the MDT too. They could learn so much. Exclamation mark.
Yeah, I think any student, what I'd like to see us go even further, and that's why we changed our definition at Salford, because we were actually thinking about other students, such as history students, art students. You know, we're a university, and why wouldn't we want to have some of these opportunities for them as well? So yeah, but that's obviously bigger blue sky thinking.
Yeah,
and
yeah.
still
World
on a journey.
domination.
Yeah.
Someone shared, Lynn has shared a paper in the chat about geriatric care and in 2004, and a talk published in 2009, which you may well be aware of, Melanie. Oh, how funny. Leanne was thinking on the same wavelength as you. Are there any plans to open this more broadly to students who are on non-accredited courses, such as we have BSc Health and Social Care students who'd really benefit from it? That's really funny. She was definitely on your wavelength there.
So I'd say yes. So we're looking at trainee associates, we're looking at apprenticeships, because why not? Why wouldn't we want to offer? And the good thing is because we're across 4 universities, we actually sit down with a list of all the programs with the care home managers and say, who would meet your needs of your residents? So they can actually have a pick and mix kind of. They say, well, we'd like students from these professions. So we've got some who may only want students from learning disabilities, OT and physio, whereas we might have a bigger home who says, we'll have them all, thank you very much. You know, so there's a real pick and mix.
Fabulous. Tony's made a comment. As an athletic trainer in the USA, it's great seeing sports rehab students engaged in IPE in the UK. And as you say, it's that broad field, everybody come one, come all kind of thing, isn't it?
Yeah, and what was really beautiful, Tony, is that it was lovely to see the sports rehab students working with the physio and the podiatry students. So that was in the first feasibility study, how they really worked and used sport with some of the residents as the activity to improve. There was a gentleman who'd had a stroke, been admitted to the care home, he'd loved football, he'd been a Manchester City fan all his life, and he got visibly upset when he talked about the impact of his stroke. So the sports rehab student, the podiatrist and the physio student and the nursing student worked with him, and they did an exercise regime on they bought some bicycles, you know, exercise bikes. He then got a sports massage after that. And at the end of 6 weeks, they actually took him to a match. So these what care homes do, though. The care homes that we work with, they want to, you know, help the residents self-actualize, and they're not sat around in chairs just watching each other. They're very active.
Oh. Hester has said she's got to leave, but Tony, how can we share the links to Melanie's presentations? Will we do that separately with the recording?
What we do is once the video is downloaded, we will clean it up a little bit, put it on our YouTube site, and we'll post it on the website and share it through social media. So follow us on interprofessional.global social media, and you'll be notified immediately when it's ready. Yep.
Brilliant. So Kelly's just asked, probably this is our last question. I wonder if biomedical engineering students would find this experience valuable to explore the development of biomedical device creation to benefit older adults in care homes. Wow.
Definitely. And I also think things like students who work in textiles and fabrics and fashion. I mean, if you look at some of the shoes or clothes for people who have maybe a disability or an impairment, they're not nice, are they? They're not very flattering, or they're very functional. Now, having done studies looking at the use of pressure redistributing chairs in people's own homes, most equipment abandonment is because the aesthetics, it doesn't look right, it doesn't fit. Even though somebody has a disability, it doesn't mean that they don't want to look nice and feel nice. So I think there's real opportunities, and I think with engineering in particular, sometimes what we think people need is not what they need at all. It's our need, not theirs.
It's funny, this takes me back. So I wrote a note talking about what I absolutely love about your study is that you are hearing the service user's voice, the resident's voice, because there is so much research about how much students enjoyed IPE, but it's more difficult to get from the service user perspective, isn't it, with ethics and whatever. And it just shows you, by hearing their voice, it just broadens the whole thing out, doesn't it? And it makes it real, which I think is absolutely amazing. So, yeah, kudos to you. What a fantastic study. And let's hope you get that 1.8 million next week.
Yeah, that'd be fabulous.
So thank you so much. It's been a wonderful presentation. I'm sure I've absolutely loved it, and I'm sure everybody else has as well. We've learned so much, and we're all waiting to have access to those documents and have a really good read about it. And as I say, I wish you all the best for next week, Melanie. Thank you so much.
Oh, thank you, everybody. Thanks for inviting me. I really appreciate it.
You're a superstar.
Oh, thank you.
Thanks.